I think we should probably move forward with our stories, Teresa.
Yes.
We have some song and dance. Well, maybe not dance, but definitely song. And we have some heartfelt, like, this is what's happening. And I think we should just go ahead and have a chance to see these stories.
Okay, so just to say that this has been done. We did it in the hospital across everybody that works in a hospital, and it was very successful, and people asked for more. So we are bringing you something we think works. So Christina, can I ask you to bring up Aaron's story?
Hi everyone, Aaren Topley here, Provincial Manager of Can You Dig It with the Public Health Association of BC. Can You Dig It is a community garden and inner city growing program that supports municipalities and communities in growing food. I was asked today to talk about how COVID-19 has impacted my work. And so I'm going to just kind of reflect on a few stories and experiences over my time. I remember when COVID really started to get a lot of media attention and we realized things were starting to close down. I think like many people, I was pretty worried. And so I started to reach out to community members here in Victoria, or the homeland of the Lekwungen people, now known as the Songhees and Esquimalt nations. And I asked them, kind of my community members, what they were seeing, what they were needing, especially folks within the food security field. And I think a lot of the buzz was around, people worried that the shelves were going to go bare, that we weren't going to have food. And so it was right at the beginning of spring. I remember thinking, it seems like a lot of people are really interested in growing food. A lot of the stores are running out of supplies to grow food, such as soil or leaf mulch or even plant starts. And so I made a few phone calls, talked to some city staff people, talked to some city councilors, and within the first couple of weeks of things starting to shut down, we were able to put forward a motion that converted the city's greenhouses into a place to grow seedlings for residents that have been impacted by COVID. And so the first month of that was supporting the city staff person who was running the program in getting it executed and kind of working out some of those details on the back end. So the program had two pieces. One is getting leaf mulch and compost to people so they could lay the good foundation of soil to grow that food, and the next was actually getting those seedlings to people and figuring out the logistics of that. And so that was a really successful program. I had a lot of community partners building it out. It intersected with the Farm to School BC program and different organizations that help people grow who maybe didn't have access to land as well. And so that program ended up getting national and international media attention, and it's still used as kind of a good story of what can happen when a community comes together and tries to help each other around growing food. Outside of that, a lot of my work has changed in many ways. I kind of like to say that it's been accelerated. A lot of the time when people are talking about food insecurity, especially at a government level, it hasn't been talked about that much. And so we're not really, before COVID, we weren't really allowed to talk about food security or food insecurity that was happening throughout the province. And then when COVID hit, I think the cracks that many non-for-profits were filling, they couldn't fill them anymore. And so everyone was looking and seeing, wow, there is so much food insecurity happening within this province, within this country, just because of the ensuite of that. So a lot of my work has actually pivoted to try to support more food access programs, more community food development roles, and supporting the province and supporting different non-for-profits to try to figure out what is the role that we're all playing in making sure that people have access to healthy, fresh food. And I'd say this is an ongoing story. It doesn't just end with this moment right now, but I think over the next months and the next years, some of the work that we've been doing and taking on at PHABC is going to have some really strong impacts within community and benefiting people in a way that we never thought was possible. And so with COVID being obviously causing a lot of trouble and hardship for people, I think there's also a bit of a silver lining that it's creating a lot more collaboration among organizations. It's creating stronger relationships of people actually wanting to work through some of these really challenging issues and figure out how do we support people where they're at? How do we support people that are dealing with food insecurity? And so, yeah, I guess it's to be continued.
Oh, thank you, Aaren. The silver lining, that weird advantages we get. I've found that actually using the phrase food security, more people get it than ever did, right? I remember people saying, what does that mean? You're going to put up, border guards? And to actually know that now people do understand some of these complex issues in this visceral way. So thank you so much for that. So Christina, our next storyteller, is a PHABC rock star, and we all love Dr. Trevor Hancock.
Greetings, fellow public healthers. Many of you will know me, Hancock, and a public health physician and retired professor of public health. What you may not know is that I'm also a Morris dancer and a singer, and actually also a green man. And so I want to share with you a little ditty that I put together, which we are developing now also as a dance, and we will dance it in public once COVID is out of the way. But here's to you, and here's to my song in just a minute. Because, of course, as a Morris dancer, drinking beer is an essential part of it. So this whole thing began with this cartoon, which appeared in The Spectator about a month or two ago. And you will see it's a bunch of folks breaking all the rules, having a grand time outside of a pub called the Jolly Virus. And when I saw that, I started to put together in my head and soon on paper a song. And the song is called We're Off to the Jolly Virus, or actually that's the chorus. I've now called the song the Super Spreader Song. And so I'm going to sing you the Super Spreader Song. And someday in the future, when we can all go out and dance in public again, we will dance for you the dance, which will be called the Jolly Virus. So here goes. Here is the song. We're off to the Jolly Virus. To the Jolly Virus we'll go. Don't preach to us, don't even start, 'cause we won't stay 6 feet apart. We're off to the Jolly Virus. To the Jolly Virus we'll go. Oh, we're off to the Jolly Virus. To the Jolly Virus we go. We won't be wimps and use a mask, no matter how you plead and ask. We're off to the Jolly Virus. To the Jolly Virus we'll go. Oh, we're off to the Jolly Virus. To the Jolly Virus we'll go. Hand sanitizers not for us, no matter how you swear and cuss, 'cause we're off to the Jolly Virus. To the Jolly Virus we'll go. We're off to the Jolly Virus. To the Jolly Virus we'll go. We'll cough and wheeze, we'll snort and sneeze, we'll bring the whole place down to its knees. We're off to the Jolly Virus. To the Jolly Virus we'll go. Final verse. We're off to the Jolly Virus. To the Jolly Virus we'll go. We'll wheeze and cough till our socks fall off. We'll get you whether you're peasant or toff. We're off to the Jolly Virus. To the Jolly Virus we'll go. So, to the Jolly Virus, and to future dancing and singing and good fun and good times. Cheers.
That was quite wonderful. I was watching heads nodding in time and big smiles on the screens I could see. And that's leadership, again, when you are willing to sing your homemade song. So we're now going to Lara's story. Lara works in Northern BC. So can you set her up, Christina?
Hi, my name's Lara Frederick. I am a nurse working in Dawson Creek, BC, and I wanted to share a little bit about my COVID experience over the last many months. So back the beginning of 2020, I was a stay-at-home mom to one adopted daughter and was off on leave from my nursing position and enjoying it. And then everything started happening with COVID. A couple months after the beginning of what we saw in Canada, so maybe about April, I was contacted by my manager and asked if there would be any way if I could come back and support some of the COVID work that was happening for Northern Health. So of course I tried to figure out what I could do, and was able to work it out with my family, and I actually came off of my adoption leave from work a little bit early, and I was due to not come back until November of 2020, but you know, just felt that I really needed to give help if I could help. So I came back and joined our COVID team for Northern Health. It was just a handful of nurses, maybe 3 or 4 at that time, and we began doing case and contact work for those people who were getting tested for COVID, and then of course being positive, and then all of the contact tracing that went along with that. So I worked with that team probably 3 days a week, and it slowly ramped up over the summer, and then in September of this year we adopted another baby boy, and I was still, you know, technically on my leave from my first daughter, but back at work helping with COVID, and continuing to support as much as I could. So he's been home now since September 16th, and I continue to help that team as much as I can. It's a bigger team now. They've trained a variety of people to help, not just nursing staff, but other health professionals to help do case and contact management work. And I help a couple days a week still, phoning people in Northern Health, either who are contacts, who've been identified as a contact, or people who are fighting the COVID virus. So, you know, it's been a challenging time for me, starting a family in the midst of COVID, and then being a nurse who obviously wants to help as much as I can all the people in my community. So I definitely am grateful for, you know, having this this crazy experience, and you know, having the closeness with my family and the time to just hunker down and be a family, and also, you know, the ability to really support my community from home. That's been important to me, and I'm grateful that I was encouraged to work from home and set up at home, and you know, all the support that I've been given from my health authority while I've been on leave and helping here and there casually. It's been really great, and despite everything, you know, it's been a horrible year in a lot of ways, and for a lot of people, but you know, I like to look at the positive side, and for me, I feel very blessed that I've had an exciting year with my family, and also a year for me to really give back. So I just wanted to share a little piece of my story and what I've been doing to help the COVID situation in BC, and in particular in Northern Health. And yeah, I hope everybody stays healthy and you don't get a call from me. All right, cheers everyone, bye.
Oh, thank you, Lara. That this story really highlighting dedication that is so common in our workforce. So, Chris, I understand you're actually really in control. Can you bring up our last story, please?
Hi everyone, we're the social media team from Bridge for Health. We're also all SFU alumni from the Health Science program. My name is Christy.
I'm Navneet.
And I'm Poonam.
And today we're gathered here to share a little bit about our Create Hope project. But before we proceed, we just want to acknowledge that we're currently on the shared unceded traditional territories of the Semiahoo, Katzie, Coquitlam, Kwantlen, and other Coast Salish peoples. In relation to the land and its people, we situate ourselves here as settlers. My family originates from Hong Kong, and Poonam and Navneet's family from Punjab. We acknowledge that we have the privilege to live, work, and play on this land, and that includes participating in this video. So without further ado, let's get started.
All right, so in the context of the current state of isolation recommended by public health officials across the country due to COVID-19, we launched a new arts-based initiative through an alliance with the Dundas West Open Air Public Art Museum, Toronto, the alliance between local Canadian art and health advocates, Bridge for Health Vancouver, and Dundas West Open Air Public Art Museum, Toronto, called for an arts-based health promotion initiative in response to the demand for health support for families to cope during the current COVID-19 pandemic and its unprecedented circumstances. With the uncertainty of the pandemic, this initiative aims to foster community engagement and resilience using art. The hope is that once the isolation restrictions are lifted, artists can paint the mural on the streets of Toronto, the Create Hope Mural.
The Create Hope digital art mural invites all families to join the collective effort by submitting their interpretations of hope. People submitting their artwork on Facebook, Instagram, and Twitter were encouraged to use the hashtag #CreateHopeMural when posting and sharing their content in order to increase engagement. Based on the data collected, the majority of submissions were between the ages of 5 and 18 years. In a 6-week period from April to May, we managed to collect a total of 30 art pieces. The submissions collected will all be projected onto a collective digital collage that forms a mural to showcase the various expressions of hope as an inspiration to us all. The project aimed to foster community adaptability and resiliency and support families in coping with the pandemic. With the participatory nature of this project, what resulted was a unique perspective and learning opportunity for the Create Hope organizers. We recognized that future health promotion campaigns and interventions should capture the adaptive nature and the current social context that people are in.
Through this project, we were able to learn 2 really important things. The first one is that an arts-based health promotion initiative really brought a lot of communities and families together. It allowed them to engage in a way that brought a lot of positivity and joy in this uncertain time. And through consent and sharing the art submissions on our social media, we were able to create a sense of community for those who may be experiencing social isolation during this time. In addition, we recognize the value of participatory storytelling through art as an alternate way for people to express their feelings and emotions. Overall, we're very happy with the results of our project, and we're really excited to see the final mural in the streets of Toronto. Thank you to all those who participated in this event, and thank you all for letting us share our story. We hope you all have a wonderful night.
Thank you. Shannon, we were wondering if you would like to make a comment about this particular story.
Thank you. Paola would have introduced the video and the initiative. Unfortunately, she's had a small injury. She said to let you all know she's fine and she's being taken care of. And so PHABC partnered in the Create Hope mural, spread the news across all our social media channels, and encouraged our own networks to respond. The creative interest here was in using art as a therapeutic modality, as a way to release stress within the community and to celebrate our resiliency. I think the students did a beautiful job representing the effort and sharing some of the content. We were interested, in fact, that folks responded from across many ages, in particular the knitter, whose work Della Wilkins, who decorated her yard with a new piece of knitting every day, and who ended up creating quite a splash, was actually covered on national media. So the Create Hope mural contributed to people being aware of what she was doing to brighten her neighborhood. And I think that's one of the things that's very interesting for us in terms of health narrative, is the way that people experience stress and trauma and isolation and change, and what we can do and the various ways we can reach out to one another, even within a socially isolating interval. So I think Paola's really, really proud of the cooperation with the Living Museum in Toronto and the possibility of the mural, and we'll certainly be able to post images of the mural once it's created and celebrated again, and hopefully by our conference next year. We'll be in a position to do that. But thank you so much for creating room for her in the agenda.
Thank you. As that last story shows, the power of image, the power of visuals is so important. So, Maureen, do you want to take us through our acknowledgements?
There are so many people. I hope there are so many people who have contributed to the success and the vision of what capacity building can do and is doing and will do. I'm not going to read everybody's name off. A picture is worth 1,000 words. So there are many, many people who have contributed. Just a special thanks, though, to the PHABC admin staff, Christina and Chris. You've been amazing in supporting all these initiatives, and you hadn't been mentioned before in this AGM. So I just wanted to really thank you again for all that you do, your ability to connect us and move us forward. We are going to move forward with an evaluation. And Teresa, I'm going to turn it back to you for you to explain that whole piece. And we will be doing this live so that you'll get to see what your responses are. It's sort of like a Mentimeter that we've done in the conferences. So stay tuned and let's go for it.
Okay, everybody. So what we have is we have a short little survey that we would like you to participate in. And what we're looking for actually is your feedback. And if you, and as Maureen mentioned, we've used Mentimeter at our conferences, so you may be familiar with this. But what we're looking for is for you to go to the ahaslides.com, and then when you get there, it will ask you, do you want to be a participant? And you put in that code. So you can see our short feedback form if you do that. If you can't wait and you really need to get back to something, you can take a picture on your cell phone of this, and we'll keep it open so that you can actually be able to contribute later. So I'm going to try. We did work very hard, and we had dress rehearsals and practices. So I'm going to try and share this one. Share. So this should give you, oh, see, where things are already arriving. So we have, what stories would you like to hear? If you were thinking about, being able to listen to stories from the public health front lines, what sort of stories would you like to hear? You can put in more than one word, and you can enter more than one time. So we are hoping to, so we are getting early direction. So this feedback is important to us because that will help us as we go forward in developing the workshops, the 3 workshops we want to carry out. We're hoping that we will get a variety of stories across, referring back to Irv's comment from the elders in our midst, as well as from the young, brand new, fresh, minted, across the regions of this beautiful province, from across the different professions within public health, and that we have something that really is a diversity of public health as it's working in these epic times. And I think it was Maureen who mentioned we would be getting history, this would be making history, but at the same time, we're also looking at, learning from each other and supporting each other. So I'm going to move on to the next question, but you can still contribute. But what we would like now is, how do you see yourself participating? And we went with a very positive thing that, everybody, there wasn't going to be anybody who said we don't want to do it. So it is a bit of a biased survey, but we're actually looking at trying to gauge the interest in people actually sharing their stories. And as you can see, we're going back and forth between sharing and listening, and both are important. I can't stress that enough. As you all know, you can't have a story if you don't have a listener. So this is very encouraging for Maureen and I. So that, I think, concludes our presentation. I'm going to hand it back to Maureen to close it out. And we do thank you for your participation, and please continue to contribute to our little survey. Maureen?
So yes, I'd just like to thank Teresa for all her brilliance and her previous experience with this opportunity. And yeah, it's been lovely to be able to present these stories. Shannon, did you have anything else, or Juan, did you have anything else that you wanted to say before we close?
I think I just wanted to thank both of you. I'm always inspired by the power of story to transport us to a different place and different time, and how over a few minutes you were able to take us to a freshly planted garden in Victoria, or a pub full of jolly singers, and a mural, upcoming mural in the streets of Toronto, as well as the life in a growing family in Northern Health. And I really thank you for your leadership in unleashing the power of story in our association. And I really looking forward to seeing how this becomes more of a reality and a new venue for us to communicate the work that we do. And it's such a powerful way to make it personal and to share the nuance that sometimes gets missed in other forms of communication. So thank you for your leadership.
I just want to pop in to say that Maureen and I really appreciated the support of the leadership. When we first proposed this, they got it. They absolutely got it, and actually took it further than we would have on our own. So again, great leadership in this organization. We're so appreciative.
Shannon, did you have anything that you wanted to say, or?
I'll just close by saying that, when I sat back and listened to our entire AGM and the number of places our people are, the kinds of projects our people are doing, the strength of our membership, the service that they're delivering, it's deeply inspiring. And I am very grateful to Capacity Building for continuing to stretch our capacity and to do outreach. And I know, Maureen, you're passionate about student engagement, and there's so many more places we will be going together. And I think that this really represents a much more emotionally intelligent way to build the strength of our community. So I'm very grateful for this. Thank you.
Thank you.
Thank you both, Juan and Shannon. And unless there's any other comments or questions, it's 1:30, and it's been a robust hour and a half. And thank you all for attending.
And thank you. And Maureen, I want to say publicly, we are a team, and thank you for staying with me when many others would have tossed me to the curb. So bye-bye, everyone, and thank you.
Bye, everybody.
Bye, everyone.
Thank you.